Hello, I'm Carl Alston from the Leukemia Research Foundation. Welcome to our Blood Cancer Awareness Month live stream conversation with Bridget Marcellino, MD, Ph.D., who is assistant professor in the Department of Hematology and Oncology at the Icahn School of Medicine at Mount Sinai in New York. Hello, Dr. Marcellino.
Hi, thanks for having me.
Thank you for participating today. Dr. Marcellino received a research grant from the Leukemia Research Foundation this year for $100,000. So congratulations to you on that. Looking forward to great things, and I'm sure you're looking forward to at least, finding the results that you hope to find to be able to move forward. So the project that we funded is entitled Enhancing Natural Killer Cell Recognition of Leukemic Cells. So can you tell everybody what that means and tell us a little bit about the project and what you hope to learn from it?
Okay. First of all, thank you so much for having me. And yes, I'm very excited about receiving this grant and pursuing this research. Most people think of the immune system as being important for preventing and getting rid of infections. But it has become very apparent that the immune system is also very important for the prevention and treatment of cancer. There are many different types of immune cells. One type of immune cell is the one that I will be concentrating on, which is called the natural killer cell. Natural killer cells kill abnormal cells by releasing these toxic granules that the cell takes up and then causes the bad cell to burst. And basically what they have found is in AML, the NK cells are not working properly. For an NK cell to actually kill an abnormal cell, you need it to recognize the abnormal cell. And the way that this happens is what's called a lock and key model. And basically, when you think of a lock and key, you have to have the combination for it actually to work. And the way that this works with NK cells and abnormal cells, in our case, the abnormal cells are the leukemic cells, is that you have the leukemic cell or any other abnormal cell with a ligand on it. This ligand binds to a receptor, which is on the surface of an NK cell, and you need to have them basically combine for the immune cell to be activated. Without this activation, you can't get the killing of the abnormal cells. In AML, it has been found that there are problems both with the NK cells, which are the natural killer cells, expressing a receptor. So basically, they don't have the correct receptors on there to recognize the abnormal leukemic cell. And the leukemic cell doesn't have enough of that ligand expressed for the natural killer cell to go after it. So basically, there are defects in the natural killer cell killing leukemic cell because of problems in both the natural killer cells in leukemic patients and also the leukemic cells being aberrant. So what my research is focusing on is how to make it that you can get the natural killer cells activated in leukemia to actually make it that they can kill them. This will be by a two-pronged approach. One is by taking normal natural killer cells from healthy donors and combining this with other drugs that can activate the leukemic cells to express those ligands to be able to be recognized. So by combining a myriad of different drugs with the natural killer cells, we will see what is most effective in actually getting the natural killer cells activated to go after the leukemic cells. Ultimately, we hope that these combinations can be used in patients, but they first need to be tried out in different leukemic models. And this includes using leukemic cells actually from patients. We test the drugs on that with the natural killer cells, and also using mouse models of acute myeloid leukemia. These are made by injecting the mice with cells from leukemic patients and basically using this model to actually test the combination of the new natural killer cells with different other drugs.
Well, that sounds great. So all of this is happening, within the body. You're not really talking about a chemo drug or whatever. You're talking about the body's natural ability to find those cancerous cells and destroy them, maybe with the help of medication, but not chemotherapy. It's like your own biology is killing these cells, right?
Exactly. The way that we focus on treating leukemia currently is by using very strong chemotherapy agents that can be very toxic. What we're trying to do is actually activate the patient's own immune system by giving it a little bit of help to actually combat the leukemia. So it's a different way of approaching the leukemia, which hopefully has less toxicity than chemotherapy.
All right, so we've got this project going, and you end up finding out what you want to know, or it ends up ending the way that you plan for it to end. So, how does that fit within the entire world of blood cancer science?
Right. So, we hope to learn several different things from this. Basically, what we're doing is a screen of figuring out ways to activate these natural killer cells to kill the leukemic cells. But whatever we do in the laboratory always has to then move forward to the patient. And that is a multi-step process. But the greatest hope of somebody doing research like this is that you actually find promising results, that one or more of these combinations will allow for you to actually activate the immune system in the models that we're using, and actually it leads to killing of the leukemic cells. And if we do find that, then we can move on to clinical trial, where you actually try this combination within leukemic patients. And hopefully you would see promise there. Although it's always a long road to get from actually the laboratory results to it being approved, for patients.
Yeah. Hopefully with the help that we were able to give you, that we'll be able to make that move a little bit faster, and then everything works out for you. Because we were really happy and really proud to be able to fund your project and your exciting work this year. And we had some help from the Teddy Kim Foundation in New Jersey to support this grant too. So I want to say thanks to the Teddy Kim Foundation. And please tell us, how has this funding helped you with the project and also helped with your career?
Yes. So first of all, thank you very much to the Leukemia Research Foundation and the Teddy Kim Foundation for funding this grant, because it's really allowing me to get a jump start into getting results on this project, to be able to further it along. And as you said, to move it as close as we can to translating into the clinic to actually help patients. So, particularly when people are just starting off their career, I just became an assistant professor in January of this year. I graduated from fellowship and have started my own lab. It's a very challenging and sort of precarious time, because traditional funding mechanisms, that is generally getting funding from the government, is limited. And often reserved for very established investigators who have been, having their own lab for a long time. And so therefore, to get a jump start to actually be able to get data and build a program, it is really, very helpful to be getting funding from a foundation. And that's how a lot of new investigators get started in their area, is through the support of foundations from many people that are doing that. And we realize that it's coming from an army of people to actually get it, so that we're able to test our hypotheses and hopefully bring them forward to the patient.
Cool. So again, congratulations on getting this funding. And like I say, we hope that everything goes beautifully. So let's change our approach a little bit. How did you become interested in science as a career?
So, I think how I became interested in science and in medicine, sort of every step of the way, has largely been dependent on the teachers and mentors that I've had. And I think any success I have will be a testament to sort of the people that have guided me in this process. And really, my initial interest in science came from when I was a sophomore in high school. And I was taking a chemistry class, and often I had teachers that, had been teachers all their lives, and that was amazing to have them. They knew so much about their area, but I had never sort of come across somebody who had come from another sphere of life and then transitioned to teaching. And the teacher that I had for chemistry had his Ph.D. and had come from actually a industry whereby they were trying to figure out how to better decaffeinate coffee beans. And for some reason, that just hit me as something that was really exciting and seemed applicable to the world. Everyone loves their coffee. And I was thinking, like, this is something that would be really cool, is to be able to play around with chemicals and come up with something new. And so I loved that course, and then decided to pursue chemistry in college. And I was a chemistry major. I'd actually planned to move forward to get my PhD in chemistry, but then had another mentor in a biological chemistry class who suggested that I look into MD PhD programs, because I was very interested in applying research to actually the patient and getting it as close as I could to helping people. So I then applied to MD PhD programs, and then came to Mount Sinai now about a decade ago to start the MD PhD program, where you get combined training in both clinical training, where you're seeing patients and learning to take care of patients, and research training, where I worked in a laboratory, actually at that time focusing on neurodegenerative disease. It wasn't until after I finished my PhD that I realized that I had an interest in cancer.
Wow, that is unbelievable. So I can totally relate to the thought of you being a sophomore in high school. You're in a class or maybe a lab, and it's 8:10 in the morning. You're dying for some coffee, and then you get this history from your teacher that has done this stuff and all that, and then everything just clicks. That's unbelievable. Unbelievable. And then, of course, the rest of it, of course, came from you, because you had a desire not only to, follow, your science dream and do research and stuff like that, but you also wanted to help people. You wanted to have the work that you did apply to, patients and stuff like that. So the cancer community is very lucky to have you doing this, doing the research. And I guess what is the I don't know how you do this. How can you do lab research and then go out and, be in front of patients and be talking to patients? What is that sort of, balance, or what is that like to be in the lab? I'm doing things that could save you, and then being in the clinical arena saying, all right, well, now I've done this, so let me see if I can help you.
Yeah. So, I mean, I must say it's exactly what I thought it would be when I went into it. It's extremely exciting on both sides. But I think, what is amazing about being in the position of both being able to take care of patients and also do research is that you have the patient in front of you showing you what's needed. And you realize, as you're taking care of patients, particularly patients with blood diseases, in my case, leukemia, you see where there's a need for the development of new therapeutics. You see that, a majority of the patients are not going to be cured, and that something new is needed. And that is a real stimulus to bring back to the lab. And you also start to think about what treatments they are receiving and why they're not working, and what you can potentially try next to be able to develop something new and to hopefully put them in a better place.
So, you said, as you were, coming up in science and stuff like that, you discovered your penchant for cancer. Is there anything about blood cancers that especially drew you?
Yeah. So, as I said, after I came back from my PhD, you go back into your clinical years where you start seeing patients. And I did rotation on the leukemia service. And these patients really were just amazing to me. Patients that are going through leukemia and needing to get a transplant are just such strong people. And it's amazing to see how much they go through and yet how positive they're able to stay. Their resiliency is really, a testament to both their own, I guess, inner spirit, and then also their family surrounding them. And I just felt, a need to sort of fight for that group of people, because I really saw what they were going through. And on the other side, I also found the science of it very interesting through discussing with other mentors what could potentially be driving the disease. And it just seemed like it was a perfect fit to have patients that actually needed new treatments and having an interest in this area scientifically.
Yeah, totally hear you about that. Being able to, talk to a patient face to face, talk to their family, they're going through something, very emotional and, could be physically difficult and everything like that. And just being able to have that interaction with them is so motivational, certainly on our end as the Leukemia Research Foundation, and definitely on your end as the person they have come to for help.
Right.
So, what do you think is the most difficult part of your day?
So I think the hardest part is recognizing how slow the process is from starting research to actually getting it to a patient, and that brings up the need for supportive research, because we need to be reminded, as we're reminded daily, that things can take a lot of time and a lot of backing to be able to move new ideas forward, and that there's a lot of failures that happen, and you sort of always need to think of the next thing to do to be able to make it work. So I think one thing that's hard is when seeing these patients, you do all you can for them, but knowing that what you're doing actually in the laboratory can help eventually is a wonderful feeling. But just knowing that it's going to take a lot of time to get there is sometimes hard to reconcile. But as I said before, that is a stimulus to be able to sort of treat the patients today as best you can and give them everything you can, and then go back to the research to do everything you can to help the patients of tomorrow.
Cool. Let me just remind people that we are speaking with Bridget Marcellino, MD, Ph.D. from the Icahn School of Medicine. If you have questions for Dr. Marcellino, all you have to do is write them or type them into the comments section on YouTube and on Facebook, and that question will come to me and I'll be able to ask Dr. Marcellino. So just want to remind everybody of that. So you are a scientific researcher. You are also a medical doctor. At some point, you go home. So how do you achieve sort of work-life balance when, to me, it seems like you could easily work 16s for the rest of your life?
So yeah, it's very important to be balanced. And, I have been very fortunate all along to have a very supportive family who's very close, and everyone lives nearby, which makes it a lot easier to be able to spend a lot of time together. But they definitely are grounding and very supportive all along the way through sort of all the different transitions that I've gone through, but also very excited for the work that I'm doing. And that means a lot. And the same goes with my friends. One thing that I sort of do as a sort of another entity in my life is I do Irish step dancing. I've done that since I've been small, and up until the pandemic have been doing it competitively. So it forces me to leave when I have to leave, forces me to exercise. And it's also a totally wonderful group of people who don't know that much about science, so I don't have to talk about it when I go there. And if I'm aggravated, I can sort of stomp on the floor. So
I was going to say, that would be a great form of letting out a little bit of tension with that type of dancing. Not as damaging to the floor as, say, flamenco dancing, but still, it would give you and the floor a workout. So that's pretty cool. I wanted to ask what you would have done if the whole science and doctor thing didn't work out. What was your next thought?
So I come from a family of lawyers, and I think I probably would have gone to become a lawyer. But I think part of that is because as I've grown up, and this is a shout out, I guess, to my brother who has helped me even along the science pathways. It's very important to know how to argue well. And I've learned that the importance of evidence to make your case. And in science, that's extremely important, as it is in law. So I think I probably would have followed in everyone else's footsteps in my family if it hadn't worked out. But I don't even like to think about that, because I love where I am and what I'm doing.
Well, that's great. And it sure does come out that you love what you're doing now. And it's great that you have the support of your family and everything. And yeah, the whole the whole building blocks of the law thing. Yeah, I could see how that works out. So that's great. And lucky that you have a brother like that, because, he's been able to help you be who you are. So that's awesome. One more thing I want to ask you. Do you have, for other people who are sitting in their sophomore class, wondering what they're going to do with their life and think they want to pursue science, do you have any sort of words of wisdom or encouragement for people like that?
Yeah, I say go for what you love, and be ready to be persevering in it, because whatever you want to do is going to take a long time to get to where you actually want to be. But you have to realize, sort of always keep looking towards the future, and sort of that you can get there, but also enjoy the journey along the way. There's a lot of stops along the way, and you're making a difference as you go along. And one, major piece of advice that I have is find people that you want to be like. In my situation, as I talked about, my chemistry teacher, there have been many people along that way who have done that. My mentors in my fellowship program, Ronald Hoffman and John Mascarenas, who are both very very dedicated to finding cures for leukemia and different blood malignancies. They have, had confidence in me, and also showed me the path to get to where I am, and I know will continue to guide me. So it's very important for you to talk to other people, talk to guidance counselors who can point you to people. And, it's easy in today's age to just send an email to somebody that you think you may want to be like in the future. And, everybody wants to hear that they have people following in their footsteps. So they'll be happy to help guide you along the way. So go after great mentors.
Well, great. Thank you so much, Dr. Marcellino. This has been an unbelievably cool discussion. Dr. Marcellino is assistant professor in the Department of Hematology and Oncology at the Icahn School of Medicine at Mount Sinai in New York. And thank you all for participating with us today and watching with us. It's Blood Cancer Awareness Month, and we will have another live stream, this time with a researcher who is in Italy doing his work right now. So we will be talking to him pretty soon. It's Blood Cancer Awareness Month, and if you want to help us out both by spreading the word about blood cancers and by, if you can, donating to the cause, please visit allbloodcancers.org. From there, you can find out, click on the Blood Cancer Awareness Month link at the top of the page, and you can find out how you can help us spread the word about blood cancers and the important work we're doing. Also, if you go to allbloodcancers.org, you'll see information about our upcoming patient education program. We have one coming up on September 30th, and then 2 weeks later on October 14th. During this virtual program, you'll be able to learn a little bit more about aggressive non-Hodgkin's lymphoma, about CAR T-cell therapy and other immunotherapies. We'll also be talking about myelodysplastic syndromes and acute myeloid leukemia. So visit allbloodcancers.org, click on the virtual program link at the top of the page, and you'll find out all the information you need, the topics and what dates we're going to be speaking about those topics, and you can register there. So one more time, though, if you have the ability, please donate to our cause and help us to continue to offer these patient programs that we do, and to be able to fund important research like Dr. Marcellino, so that we can find a cure for these blood cancers, and along the way, develop better treatments and better medications so that people live longer and are eventually cured of these diseases. Again, I'm Carl Alston with the Leukemia Research Foundation, and we will see you next time.